Eribulin solution is a medication used to treat specific types of cancer, such as breast cancer and liposarcoma. It functions by slowing down or halting the growth of cancer cells in the body. The dosage and timing of taking this medication will depend on your medical condition and response to treatment, so it's important to follow your doctor's instructions carefully. It is important to take Eribulin solution at the same time each day to maintain a consistent level of the medication in your body. Before starting Eribulin solution, make sure to read the patient information leaflet from your pharmacist. This medication is administered through an injection into a vein by a healthcare professional, following the schedule directed by your doctor. The dosage will depend on your medical condition, body size, and how you respond to the treatment. If you have any questions about this medication, don't hesitate to ask your doctor or pharmacist. Possible side effects of Eribulin solution include nausea, constipation, watering eyes, loss of appetite, dry mouth, changes in taste, trouble sleeping, muscle/joint pain, dizziness, tiredness, weakness, and temporary hair loss. However, these effects may not affect everyone, and normal hair growth should return after treatment. While using this medication, you may experience serious side effects, but your doctor has prescribed it because the benefit to you is greater than the risk of side effects. Your doctor will carefully monitor you to decrease your risk. Tell your doctor right away if you experienced serious side effects such as easy bruising/bleeding, numbness/tingling/burning in the hands/feet, signs of anemia, such as unusual tiredness, pale skin, or any signs of infection such as fever, chills, cough, or burning/pain when you urinate. Seek immediate medical help if you experience very serious side effects such as fainting, fast/irregular heartbeat, severe dizziness, or symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember, if you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Eribulin, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to this medication. Also, discuss your medical history, particularly if you have any blood or bone marrow problems, kidney problems, or liver problems. Eribulin may affect the rhythm of your heart, which can lead to serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that can also cause heart rhythm issues. It's important to talk to your doctor about all the medications you are taking and any existing heart problems you may have. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm problems. If you are using certain drugs or have conditions that can lower these levels, make sure to discuss this with your doctor. Using Eribulin may cause dizziness, and using alcohol or marijuana can make this dizziness worse. Make sure to avoid activities that require alertness until you can do them safely and limit alcohol consumption. Eribulin can increase your risk of getting infections or make existing infections worse. It's important to stay away from people who have easily spread infections, and to talk to your doctor if you have been exposed to an infection. Before having surgery or vaccinations, inform your healthcare professional about your use of Eribulin, and exercise caution with sharp objects and activities that could result in injury. If you are pregnant or planning to become pregnant, or if you are breastfeeding, make sure to discuss this with your doctor. It is important to use reliable forms of birth control during and after treatment with Eribulin, and to avoid breastfeeding while using this medication. It's important to take note that drug interactions can affect how well your medications work or even increase your risk for potential side effects. This list may not include every possible drug interaction, so it's crucial to keep track of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this information with your healthcare provider. It's vital that you do not make any changes to your medication dosage without first consulting with your doctor. If someone has taken too much Eribulin solution and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Throughout your treatment with Eribulin Solution, it's important to undergo regular lab and medical tests, including complete blood counts. It's crucial to attend all scheduled medical and lab appointments to ensure your treatment is on track. Be sure to consult with your doctor for more specific details regarding these tests. Make sure to take each dose of Eribulin Solution as prescribed by your doctor. If you happen to miss a dose, it's important to consult with your doctor or pharmacist to create a new dosing schedule. Eribulin Solution is typically administered once every 21 days, and the dosage will be determined by your healthcare provider based on your individual condition. It's important to follow their instructions carefully for the best results. The optimal timing for taking Eribulin Solution may vary, so be sure to ask your doctor for specific guidance on when to take this medication. This medication is administered in a hospital or clinic and should not be stored at home. It is typically used to treat patients with breast cancer or liposarcoma, a type of soft tissue sarcoma. The dosage and timing of the medication will depend on the individual's condition and medical history, so it is important to follow the instructions of the healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.